so out of control. And any treatment we do, any of the canthrone, is gonna get the eczema even flared up more. So I'm like, we have to get your eczema under control before we even consider treating the molluscum. So there's the textbook molluscum lesion and eczema flare around the molluscum lesion. Pityriasis rosea, self-limited, thought to be viral in origin. Oftentimes you can get a prodrome, history of a prodrome illness, salmon-colored oval papules, macules with a fine color out of scale. The length of the oval tends to run in the skin lines. So on the back, it tends to look like a Christmas tree pattern. And you generally will develop one single larger spot called your Harold patch, and within a week or so you'll develop the wider spread, smaller, similar looking lesion. But people will oftentimes think that larger patch is a ringworm. This is just self-limiting, will take care of itself. I say give it 3 months, and if it's still around, or for sure if you're getting new lesions at that point, come in and we may need to biopsy. Light exposure can help. Topical steroid, mainly only if they're itchy. It's not really going to help the rash go away, but if they tend to be itchy with it. And there's a Harold patch in the smaller lesions. I don't think I have that many more slides. You want to keep plugging through and just be done? Okay. Roseola. So roseola. I'm not even going to try to butcher that. Surprise rash. That's a human herpes virus. You sudden, unexplained high fever, and this fever can be high to the point it can sometimes trigger febrile seizures. The fever comes down, and then you develop this morbilliform rash to the neck, trunk, buttocks, sometimes the face and extremities. So mainly the truncal area. And then the rash will resolve in 1 to 2 days. So this is a very self-limited thing. Nothing, just reassurance. And you're going to find these pictures of a lot of these viral exanthems, these viral rashes look pretty much the same. So it's going to be your clinical history that will help you decipher. Measles or rubeola, highly contagious viral illness. Again, the prodrome of the fever, cough, coryza, conjunctivitis. I might know that those 3 C's are associated with that. Koplik spots, you have to know that. That is a test question, at least on a national board exam at some point in your life. So these are bluish-white dots with a red halo, appear to the buccal mucosa or labial mucosa. That is associated with rubeola or measles. Rash will appear a couple of weeks after exposure. Starts on the face and spreads southward. Fades about 3 days, so the total duration is about 1.5 weeks. And you probably will have widespread sloughing of the skin. When you have a rash that widespread, you're going to go through.
Sorry, that was lost.
No worries. Koplik spots, widespread maculopapular rash, morbilliform is what we call that. German measles or rubella, it's kind of similar to the other, but it's just a shorter version. It's called the 3-day measles, as it mimics a milder case of measles. Caused by a virus. Again, the prodrome, you get the morbilliform macules, begins on the face and spreads downward. but within 3 days, this is gonna be gone. So very, very similar, but just a shorter one. So how can you tell the difference between any one of those three? It's your history. Fifth's disease, or erythema infectiosum, is a parvovirus B19, you might know that. This is the slapped cheek, where the first thing that appears is these kiddos get very red cheeks, almost like they've been slapped, and then you get a widespread kind of lacy rash to the trunk and extremities. And it tends to be kind of that reticulated, lacy look. Sometimes it's not uncommon, after it all has gone away, when they get out of a bathtub or whatever, you may see that reticulated discoloration again. So it's not the rash recurring, it's just. So there's the slapped cheek look, and the other is more that widespread reticulated lacy rash. Giannotti-Crosty syndrome. This is another viral rash. You don't see this very often. These are flat top. These are going to be larger. Where all these other viral exanthems, they were all small, more pinpoint, widespread papules. These are going to be bigger papules that are raised, can be face, arms, legs, trunk. Occasionally they'll be vesicular. But you want to ask about, if you see something that kind of resembles this, you want to ask about, has he been sick? Has he or she had a virus before? Occasionally it can be associated with a hepatitis. So you may need to do an ultrasound of their liver. And see, that does look different from those other rashes. The others were much more widespread, fine macules and papules. Scarlet fever, this is a very fine papules. It feels very much like sandpaper. It's after a strep throat, strep pharyngitis. And the rash will usually present after a couple of days after the strep throat. Oftentimes you will get kind of a white membrane on the tongue. When that sheds or sloughs, it's going to lead to that bright red strawberry tongue. I would know that also. And desquamation, widespread desquamation is very, very common with this. Kawasaki. We don't really know exactly what this is. This usually, or what causes this, it's kind of a hypersensitivity reaction to something. An infectious agent of some sort. Usually the very young, 4 years or younger. You have to have, it involves a number of things. You have to have 5 out of the 6 criteria. Fever of at least 5 days, a rash, stomatitis, inflammation of again, strawberry tongue, fissuring, cheilitis, edema, swelling of the hands and feet, injected conjunctiva, and cervical adenopathy. I might have a pretty good idea about Kawasaki's and what you can see with that. So acutely high fever, acute onset, the baby is very uncomfortable, or the toddler. The rash develops shortly thereafter. It can look a lot of different ways. So the rash is not going to be, indicate what's going on. As the fever and rash improves, that's where you can get into some cardiac and blood vessel issues. Treatment is with IVIG, so you're going to be, this person is going to be hospitalized and receiving IV immunoglobulin. So here's some pictures, that strawberry tongue. See how red those eyes are, the swollen feet and hands. just the strawberry tongue, the lips are all red and inflamed, the stomatitis, and probably has some cervical lymphadenopathy and high fever. HSP, or Henoch-Schönlein purpura. This again is kind of an allergic reaction, and it involves the blood vessels. Oftentimes it occurs after strep or another viral infection. Again, 4 to 8 years of age is the peak incidence, more so in males. Palpable purpura is kind of the definition of what you see here. They're gonna, anything that's vascular is gonna be a deeper red to have almost kind of a purpley discoloration, but these are going to be raised. You're gonna be able to feel them at least somewhat. There are arthralgias, abdominal pain, and renal disease. You need to check their, some blood work and especially their renal function. So these palpable purpura to the extensor aspects of the extremities and buttocks. Sometimes it will start off looking kind of like hives, urticarial lesions, and then will turn more into that purpley discoloration. Microscopic or gross hematuria in about 1/4 of these kiddos. Again, this is occurring not just in the skin, but internally too. So you may have some frank blood in the urine or in the stools. That vasculitis can involve the kidneys, the lungs, the central nervous system. Treatment is mainly supportive. Oral steroids are going to be what you treat, and probably kind of a long-term oral steroid, not for years, but for a couple of months anyway. And you just need to make sure that you're doing UAs and checking some blood work, because they can get progressive glomerular renal disease. And see how striking those, I mean, that obviously does not look like eczema. Getting a close-up at those are bright red and almost probably kind of have a little bit of a purple hue to it, and you may not be able to feel every single one of them, but some of them you'll be able to feel. Tinea capitis, most common cause of hair loss, infection with, we kind of went through this, didn't we? Hair breakage, black dot, okay, remember that. Because that hair breaks off way down low, so you tend to get just these tiny little black dots within the involved area. Sometimes you can get a lot of inflammation associated where it becomes real tender and boggy, that we call a carry-on. Do you want me to go through any? You've been through that a bunch, haven't you? Most common is T. tonsurans, trichophyton tonsurans, and the microsporum. But T. tonsurans is by far the most common. I'm not going to go through all that. Alopecia areata. I think we already did this too, didn't I do this? So I'm not really going to go through this. That's just where the immune system fights itself. You get generally patches of cue ball smooth, hair loss, topical steroids to reduce that inflammatory reaction locally. If they're old enough, they can do injections of steroid every 4 to 6 weeks. Exclamation point hairs is what's associated, a finding that you can see with alopecia areata. You might put the two together. Nail pitting, we talked about that. They've got some stuff they're working on, some injectables to help with alopecia areata. They're not approved yet, but at least we've got something coming up. Trichotillomania, I don't think I talked about that last time because this generally is more in the weeds. That's where kiddos will just kind of pull their own hair, either by, twirling or actually picking their eyebrows, their eyelashes. Usually something's going on at home or school, and they tend to be kind of an OCD, high anxiety. One clue to that is you generally have loss, the hair is at different lengths, okay? Rather than like alopecia areata, it's just gonna be gone. This one you'll notice hair at differing lengths. Traction, that's just tight where, people who wear tight braids or ponytails or things that pull tension on the hair shafts can long-term cause problems, can cause hair loss, and sometimes even scarring. So you want to really encourage different hairstyles, and no braids, tight weaving, things like that. Okay, now we're done. Any questions? Yes?
If you saw the AVMs in the skin, would you be worried that they were elsewhere in the body, like the brain or anything that could be really deadly? The arterial venous malformations?
I think it's mainly just localized. I
Okay.
don't think they have real concern of widespread brain involvement, anything like that. But I would certainly be sending them, to have to get a closer look at that.
Oh.
Sorry. Anything else?
If you have a toddler with perianal warts, would you not be concerned about?
Yes, you do. And there's a age where they kind of suggest, it's a very easy thing. You don't want to automatically jump into that this was a sexual related thing. Parents can have warts on their hands, and just changing the diaper, the kids can self-inoculate, excuse me, but you have to ask, you certainly do have to have a red flag, but it's not always 100%. But good question, I didn't think about that. Anything else? Questions? Well, you know where I am if you come up with some questions, and have a good long lunch. If I don't see you, happy Thanksgiving. Have a great time.